Welcome. So glad to have you guys here. Just a couple of things, if you guys wouldn't mind to please mute your mics. Any questions that you have, just use the chats. Put your questions into those, and we'll answer the questions there at the end. Also, let us know what office that you guys are chiming in from by putting it into the comments as well. And without further ado, we're super happy to have you here. And Dr. John Stavrakos, I'm going to have you take it from here.
Okay. All right. Well, thank you guys for having. Thank you, Natasha and Deanna and everyone. It's a privilege to be here. Like she said, I'm John Stavrakos. I'm the Chief Medical Officer at New Life Medical Services. And I wanted to give a short 25 minute PowerPoint today to talk a little about a few things. I want to talk about the products. I want to talk about how they're basically made, created, and brought to you. Some of their uses, some clinical cases where we've seen really good success. And then a little bit about when we do private training, if you decide to come work with us, just a little insight as to kind of how we teach, and basically I always tell people who are new to the industry, we want to tell you not what to think, we want to tell you how to think in terms of how to get really good outcomes. So I call this Introduction to Biologics Therapy. I am the Chief Medical Officer and owner of a clinic called New Life Regenerative Medicine, Heritage Regenerative Medicine. My clinic is in South Charlotte. And I got this quote from an author I know that I think really sums it up. He said, "Misery is comfortable. That's why so many people prefer it. Happiness takes effort." And I tell this to especially my musculoskeletal patients who have chronic pain, but they don't want to do anything about it, but they want to talk about how much it hurts. And say, look, you see supermodels, not all that is just genetic and good looks. It's hard work. They have to exercise. They have to diet. They spend a lot on cosmetic care. Athletes, it's hard work. Being healthy is hard work, but it is ultimately worth it. I always love this quote. This is one of my favorites. They talked about the Dalai Lama. They said, what surprised him about humanity? He said, man, he sacrifices his health in order to make money. Then he sacrifices money in order to recuperate his health. And he's so anxious about the future, he doesn't enjoy the present. The result being he doesn't live in the present or the future. He lives as if he's never going to die, and then dies having never really lived. So I'm a guy in my 50s, and I promise you, I blinked. I was 19 yesterday, and I don't know when I turn 54, but it's going to happen to everyone soon. And those little aches and pains and things will catch up to you. So I always say, live in the moment, enjoy today, and then your health is really your investment in yourself. And I tell that to all my patients. If you don't have your health, you don't have anything. There are multimillionaires who are sitting in a wheelchair on a dialysis machine who would give up their fortune to be able to do what you do. Just putting on a pair of pants by themselves, throwing a ball around with their kids or their grandkids. So never take your health for granted. The reason I like, if you read books like Peter Attia's book called Outlive, they talk about medicine 3.0. That's kind of where we are now. Medicine 1.0 was just kind of superstitious. There were 4 humors, bleed people out, they won't have a fever anymore. 2.0 was modern medicine, where we talked about, surgery and pills, and there is great benefit to that. Antibiotics can save your life. God knows trauma surgeons will save you. But the focus was really on the symptoms. You have this disease, you have hyperglycemia, take a hyperglycemic pill. You have a rheumatoid disorder, take immune blocking medication. We're in 3.0 now, and we're starting to realize it's not enough. We have to start looking at what's causing the problems and focus on that. And Bishop Desmond Tutu said this. He said, there comes a point where you need to stop just pulling people out of the river. We need to go upstream and find out why they're falling in. And that's really the core of functional medicine, which regenerative medicine fits into. What's the problem? And if you can deal with the underlying problem, not just keep masking the symptoms, you get happier, healthier people. So really, what is regenerative medicine? Because that word is thrown around a lot. So regenerative medicine is a form of tissue engineering and molecular biology, which deals with the process, replacing, engineering, or regenerating human cells, tissues, or organs to establish, restore, or establish normal function. What it is not is simply, quote, stem cell therapy. So I tell patients when they walk in, I said, I don't use the word stem cell a lot because there's much, much more to it than just stem cells. There are other things we can use. It's not just the stem cells that do things. And unfortunately, for those of you who are in the industry, know that stem cell, unfortunately, has gotten kind of almost a bad, not quite a dirty word, but it's got connotations unfairly that it doesn't deserve. There have been a lot of clinics who have misrepresented what they're giving people. There have been bad cases. And of course, the media likes simple things, and they like stories that are sensationalized because, they say it bleeds, it leads. And so stem cells are the root of all evil in some people's cases. So I shy away from that word, and I say regenerative medicine, there's a lot more to it than just quote stem cells. So this is me. When I'm not teaching Cobra Kai, I'm the clinic, or that could be a Halloween costume, you choose. I own a clinic in Charlotte, North Carolina. My background is I have a bachelor's of anthropology, University of Notre Dame. My master's from Barry University in South Florida. I got my MD at Chicago Medical School. I'm board certified in physical medicine and rehabilitation medicine. And we're a very practical field of medicine. I like to say we're the waste paper basket of medicine. No matter what your problem is, neurologic, rheumatologic, orthopedic, you end up with us because our job is to restore function. So I did my residency at Stanford, and then I finished it at the Medical College of Wisconsin. And I was fortunate enough to stick around another year and do a fellowship in women's sports medicine, where I kind of first got introduced to regenerative medicine. One of my colleagues was doing prolotherapy. And I really liked the answers and the results he was getting as opposed to what I was being taught about, therapy, stretching, time off, anti-inflammatory steroids, and then when it's bad enough, we're going to do surgery on you. I've been in this field since about 2012 and have never looked back. I'm a member at the AOA PRM, one of the best organizations out there if you're starting out for regenerative medicine. Pivotal Injury and Rehab is my friend's clinic in South Carolina. I'm there twice a month because they have a big interest there. And I've had the honor of being the chief medical officer of New Life since 2021. And it has probably been the singular most enjoyable and most rewarding vocation I've ever had. The people I've met, the places you've gone, from Costa Rica to lecturing in Vietnam, to meeting people all over the country, to learning from smart people, because like the saying goes, if you're the smartest person in the room, you're in the wrong room. You sit in a room with smart people and you get smarter. And I'm a big believer in what we do in our clinic in regenerative medicine. We do natural hormone optimization, IV therapy, ozone therapy, neural therapy, anti-aging. A couple years ago, I wrote this book. I love that picture. That's funny. Put that there. It's an ebook called The Athlete's Secret to Conquering Pain. People who are interested, I'm happy to send you a copy. I am also a patient. Like I say, people say, what have you done? I said, I have a Lifetime Achievement Award for doing dumb things that get a body hurt. So I was the kid who loved to jump from tree to tree, or jump from tree to a parking lot, or in college I used to do tumbling on concrete. I had no problem doing gymnastics on hard surfaces. Naturally, it caught up to me. And so that is a very abbreviated list of all the things I've had done. The only joint regenerative medicine was not able to save and do well was my right hip, because I think if do this long enough, that hips are the hardest joint to treat. And I pushed mine past the point of no return. My hip is great now after surgery, but both my knees are fantastic, way better than they were 10 years ago. Anytime I have an elbow issue, joint issue, it works beautifully. Every year and a half or so, I have a colleague who does some injections in my back, and my back is good for more martial arts, more soccer, playing with my kids, putting on my Greek armor and going to parades and whatnot. So this has really kept me healthy in a lot of ways. So step one is I want to talk to you guys about the process and the products. And so as you guys know, this is just a little background about, where the potential of regenerative medicine. If you've spent any time in this field, you know that the potential applications are practically limitless, from cosmetic to intravenous to musculoskeletal, from neurological to rheumatological disorders, things that previously were quote unquote impossible to treat. We're seeing promise now. And I'll talk a little about that in a minute. So we get a lot of questions about cell count, and this is a big issue. People usually want to know, well, what's a cell count? And that seems to be a thing that's kind of stuck in their head. Like that's the most important factor. While yeah, higher cell count is potentially more beneficial, but in certain conditions, what you find with stem cells is that they don't work the way a lot of people think they do. By and large, they are the job foreman. The stem cells are not the worker bees. They spend most of their duty is to secrete what they call a paracrine signal. And that's a signaling mechanism to your own stem cells to migrate to the areas that you're trying to treat. So they wake up your own body cells to come there, they go to the area, they proliferate, they differentiate, and then they mature. So your own stem cells are really doing the job. They're just giving your body a boost. So New Life products, like most good products, they work as vesicles to deliver these signaling molecules. Now, stem cells are important, but you need things. Growth factors, hyaluronic acid, cytokines, and other factors. And I'll mention that a little bit when we talk about the both the live cells from the cellular Wharton's jelly and also with the exosomes. So the picture is much more complex than we're led to believe, and much more complex than I was led to believe when I started in this industry. This is one of my favorite. This is one of those slides that if you're in this field, you know about. This is by the great Arnold Kaplan. And Dr. Kaplan looked at sources of mesenchymal stem cells. And what did they find? Pound for pound, ounce per ounce, where are you going to get the most of them? The umbilical cord tissue. Fat has a lot, bone marrow has a little bit less. But when you get them from the umbilical cord, again, we're dealing with day one cells because these are from the newborns. Once the baby is born and the cord is cut, you're looking at about one stem cell for every 10,000 cells in a newborn. Those of you who have small children know this. They split their lip on something. By the time you bring them to the ER, it's already stopped bleeding. That night, the thing starts to heal up. Children have an amazing ability to heal. By the time you hit 50, give or take 1 out of every 400,000. By the time you're 80, it's 1 out of 2 million. So this in part explains part of why we age. One of the things, we don't have the same repair mechanism. My son is 10. He plays in soccer. They had a field day at school today. And normally I would say for me, I could not run around and do those activities and then play soccer in the afternoon and not be limping the next day. He'll be fine. You know, I might work out his hamstring a little bit. Why? They have stem cells called pericytes, and they hang out around the organs and they repair. So their bank account is full. So one of the reasons we like to use the umbilical cord is just the sheer volume of stem cells you're going to get. In terms of the lab, so New Life, as you probably know, is an FDA-regulated, multi-state licensed tissue bank, and we specialize in birth tissues. On this call, by the way, is one of our associates, Luke Burmeister and Thomas Strauber here. And if later you guys have questions about processing or compliance with the FDA, they'll be happy to speak to you guys about that. So the office they have right now is in Alpharetta, Georgia, with a new office hopefully coming in Tampa, Florida soon. Our job is basically, we want to improve quality of life. People have pain, people have injuries, just aging, basically, and day-to-day living. You know, we call it the diseases of old age, neurological, cardiac arrest, stroke, heart attack, Alzheimer's, dementia. All these things come with later life. So we're trying to make people feel better and look better. So we'll talk on the process. How do we determine donors? Well, these are pregnant women who know that they are going to give birth by C-section, and they donate their product. They're not paid for it. So they do a very thorough medical, sexual, and social history. They have a physical exam. We know that tissue retrieval after birth must be within an acceptable time limit. No high-risk activity in their past for HIV or hepatitis. They have no transmissible disease, no malignancy, and no sepsis or systemic infection. And significant serology is done. And if you've ever ordered New Life products, you'll know that a serology count or a serology listing is given for hepatitis A, B, C, HIV, etc. You will see all the titers and they'll all read negative. If anything deviates from that, mom gets sick, there's an issue, that patient's usually excluded. And why C-section? Well, there's no risk of contamination from vaginal flora. So how are they recovered? Well, it's very simple. The number one question people are going to have is, is there any harm to the child? Or is this fetal, tissue? The answer is absolutely not. Number one, it's not legal in the U.S. Most people wouldn't do it if it were. But once the child is born by C-section, of course, it's very simple. If you've ever been in a birth, it's a happy occasion where mom or the mother-in-law or the aunt gets to cut the cord. Mom gets the baby. And that tissue we used to think of as medical waste, the placenta, the amniotic fluid, and the umbilical cord is taken in for processing. So this is all through aseptic technique. If the parents want to keep the cord blood for their child, they certainly may. So processing is an aseptic environment. CGMP is certified good medical practice. You meet certain guidelines. Quick side note, big reason I joined New Life years ago, and I was a client physician like a lot of you might be. Long before I was the medical director. I simply got my products from them. Their commitment to quality and their commitment to purity. They do not cut corners. I have been injecting myself, my mom, my late father, my sister, friends, family for the last 8 years or 9 years, never had an issue. So there's an absolute commitment to doing it the right way, because doing it the wrong way is unthinkable. So these products are held in quarantine to look for absence of bacterial and fungal pathogens. If there's an issue, typically they look at it. Chances are the whole batch is going to get scrapped, and they'll start over. If you know our chief science officer, Dr. Ranjan Hilly, he's an absolute stickler for this. So we're going to talk about some products here. Restore Plus, which is the concentrated cellular Wharton's jelly, the live cells, what people would call stem cells. Rexo, which are MSC-derived exosomes. And then the charge products. And Restore and Rexo Charge are simply a more dilute version of the Restore Plus and Rexo. And they're a really good secondary product. And they find really good use for a couple reasons. People who do the main product and need a booster, like for musculoskeletal injuries or cosmetic, a couple weeks later. Sometimes for people whose condition is less serious, or if the price point is an issue, these are much less expensive. And say somebody has an issue that's not that bad, or it's an older patient. You know, by older, I mean, I hate to say it in my ballpark, over in their 40s, 50s, they're pretty good, but they understand, just like getting an oil change on your car, they want a booster because they're not going to stop skiing, or they're not going to stop running or playing pickleball. And so the charge products might be very useful as a booster. Restore comes from the fetal side of the umbilical cord, and that's important because that's the side that's immune privileged from the mom. There are healing components, including the cells, like we talked about before. Big question people ask is there risk of an adverse reaction, of an immune response? The answer is, as a general rule, no. Because again, when you're on the fetal side, the amnion side, the child, as you know, babies, as you probably know if you have kids, really are lacking an immune system early in life. That's the reason why we keep them close, why in many cultures, like if you're Christian or Jewish, they have that they introduce the child at 40 days to the church or the temple. There's a good biological reason for that. The child is not really set up to handle coughs or cold or something in the environment. They get their antibodies passively with their mother's breast milk. One thing about that as well is that along those lines, these cord tissues, they last the MHC class 2 proteins. In other words, they don't identify as others. So I know of no case, and I would probably know because I'm the one that gets called about these, of an allergic reaction of the recipient of the products. They have a very strong anti-inflammatory effect on inflammatory cytokines. And this is huge. That's the immunomodulatory effect. And we'll talk about that. So Restore is concentrated either 1 ml can be Restore can either be about 5 million cells or 10 million cells, Restore Plus. And you decide how much when you order it based on what you need. Rexo is a trade name for exosomes, and exosomes to me are fascinating. Exosomes, if you read in the scientific literature, if you want to do a lit search on exosomes, you know, in PubMed or any Elsevier, exosomes are secreted by a lot of cells and tissues, so they're not unique to stem cells. Exosome is just Greek for outside the body. It's a tiny little vesicle that buds off of the main body of the cell. They are tiny, averaging 50 to maybe 125, 150 nanometers in size. It's about the size of a COVID-19 particle or virion. So, and they have in that little encapsulation, they have things like growth factors. They have messenger RNA, kind of like stem cells do. They have cytokines, which attract cells they want. They have this really cool thing in them called a microRNA. And microRNA is fascinating. And I really suspect this is the reason why so many people feel so good quickly after getting exosomes. And when I say soon, sometimes it's a couple days to even a couple of hours. I've seen it, especially with things like post-COVID. MicroRNA is just a couple base pairs long. It's like 9 to 15 base pairs long of nucleic acids. And we used to think it was junk RNA. Like most DNA and RNA in our body is just filler. It's junk. What does microRNA do, though? Well, when your body makes inflammatory markers that cause pain or swelling or difficulty, microRNA inserts itself into the blueprint. So if you remember your biology, it goes DNA to RNA to protein, you know, whatever you're making. When you insert that microRNA into there, you get a junk product. It's sort of like if you are typing out a website and you're looking up Google, instead of if you type out google.com, enter, you're going to get Google. But if you go GOOXYZ exclamation point asterisk hashtag GLE.com and hit enter, it will say what? URL not found. So my general consensus and my rule for me personally, and for most doctors, I recommend especially for MSK joints, if you're going to do a joint when you're doing the Restore, add some Rexo in there. You're going to get quicker results in a much shorter inflammatory phase. This is one testimonial by a guy. If you're an older timer like me, Vinny Testaverde, played for the University of Miami, played with Tampa and the Jets. And this was back when we did amniotic fluid. You know, this was before stem cells. This was something not as strong of a product. So he'd taken a lot of abuse in his shoulder. You know, he took a lot of sacks. He liked to play golf. He said at the beginning his shoulder became too much to enjoy the activities. He suggested he tried regenerative therapy, including birth tissue stem cells. He was first skeptical, but he decided to do it. I'm ecstatic that I did. It's been 2 months. My improvement's substantial. He sleeps better. My golf game's improved. The pain subsided. We do treat a lot of athletes. You know, we work with NFL players, especially retired NFL players who are in a lot of pain, and they find wonderful results on this. If you want more examples, I can certainly tell you. So at this point, a lot of people who have not done this, we get stars in our eyes. We think, oh my God, I have 1 million patients that would benefit from this. My first advice to people is always, I think this is true with all of medicine. Our first rule with the Hippocratic Oath is what to do no harm, right? So it's just as important to know when not to use product or when to take a pause as when to do it, probably more important. So here's just some criteria. If someone has active cellulitis or infection over the area you want to inject, I would hold off. If you're doing the lower extremities and they have extensive lymphedema, huge swelling, product's going to be diluted. It's probably not going to get there. So for your neuropathy patients or an ankle injection, try to get that under control. Non-compliance. Generally, I don't do non-compliant patients. And I'll explain that on the next page. You know, it doesn't help me if you're going to do the same things that made you ill. For peripheral neuropathy patients, it's a relative contraindication if they have more than 80% sensory loss by sensation testing. Now, that being said, I've had patients who've had bad sensation loss and have told me, I understand my odds are not as good as someone who's in better shape. I still want to do it. And I've had some really good results. Active cancer, New Life stance is at least 5 years in remission. You may adjust that to your comfort level. Again, my job isn't to tell you what to do or how to. My job is to tell you you're an adult. You may set your own standards. Here are just some recommendations. Some clinics, like I'm good with 3 years, but I want it documented that they are indeed in remission. If, for example, we're going to a joint and they've had cancer that has a predilection to going to the joints, I'll give you an example. Bone cancer, colon cancer, breast cancer. They like to go to bone commonly. I may get an MRI with and without contrast in that joint just to be sure there's nothing hiding there so I don't poke something, break off a piece and send it somewhere else. You know, antiphospholipid syndrome is where people just clot up, and you'll know that they're not stable patients. You know, they've had a history of strokes or kidney issues, really low platelet count, you know, another hypercoagulable state like antiphospholipid. So the bottom line is the patient, if you think you're going to do more harm than good, take a pause. Alcohol abuse, got to get under control first. For patients who are diabetic, I like their A1C to be ideally under 8 or going the right way. You know, if it's too high, you know, I would say podiatrists will sometimes won't do foot surgery on people whose hemoglobin A1C is under 6.5. That's really low, but they say our outcomes, our complication risks, it's like a hockey stick, shoots way up once you get above that point. I generally don't treat smokers unless they're, you know, if they're very casual smokers, now I tell them to stop. If they're regular smokers, I say, you've got to stop before I treat you. They don't heal well. The nicotine causes horrible inflammation. That is a quote up there from Hippocrates, the world's first doctor, and it's quote unquote. And he basically says, before you heal someone, ask them if they are willing to give up the things that made them sick. So you have to have the come to Jesus moment with some of your patients and make sure that they're as invested in getting themselves better as you are. I tell people, if you're not as excited about trying to get you to heal as I am, this doesn't work, because this is it's a partnership. It's not a one-side thing. You got to work with me. If you're not sure, if you think it's neuropathy, but it doesn't quite fit the picture, they got tingling in their feet, and you think it's something else, you know, could it be MS? Could it be ALS? Do your workup first. Why? Because you'll do the injections and you do some treatment and they'll get no result and they'll not be happy. And they're really not going to be happy when they find out it was something else. Here's where intravenous infusion might be helpful, because that hits you systemically. My friend Joe Radich over in West Palm Beach has a lot of great patients. He was kind enough to donate these. 88-year-old gentleman who had stem cells PRP in September of a couple years ago and October. And this was several months later. And I always tell people radiographic findings improvement is going to come way after clinical improvement. If you do someone's knees, 8 weeks later, they go, I feel great. And you do an MRI again, it may or may not show anything. I kind of doubt it. I like to do them a year, sometimes like a year later. But you guys can see this here. There is, if you look at that knee on the left there is no joint space over the medial joint space. Look at that now. Something is improving in there. Part of it could be that the ligament, the medial collateral ligament is tighter, sure, but that's a hell of a lot of space to open up. The one in the upper right, the dark one, looks really good as well. So yes, people say, can you get radiographic improvement? You can. Does it always happen? No. But do people feel better? Can they move better? I care more about clinical than radiographic because I know I'm doing something right. And I promise you, power of suggestion works only to a degree. Yeah, you can convince yourself you're feeling better. It's not going to last you 6, 8, 9 months every day. This was a case study on neuropathy. I saw this lady once. She came to one of our training seminars. She's in her 30s. She got CRPS and COVID. COVID affected the nerves in her feet. I remember she was walking on her balls of her feet because putting her foot on the ground just caused too much pain. Paresthesia in her lower extremities, down from her tibia all the way down to the arch of the foot. She's having tension because she was basically plantar flexing. Her Achilles were getting very tight, and she's getting vascular changes because she wasn't walking. She's getting swelling in her feet. It did not look good. So she got treated with PRP, Restore and Rexo, so live cells, exosomes, and PRP, and we just kind of worked our way down the nerve branches. And into the soft tissues. These are perineural injections. We also injected into the bones of her feet because she was having joint pain. Within 90 days, she got 30% improvement. And to her, that was huge. Doesn't sound like much, but if your pain is a 9 and you can't move and someone gets your pain to a 6, as someone who's had hip pain who was that bad, the difference between a 9 and 6 is a godsend. Overall now, she has seen improvement. She'd been seeing, I believe, Joe's clinic. And now her pain is minimal. She's walking normally. She has minimal discomfort, and her life's back to normal. Here's a good article. People were talking about, well, can you give me some examples? Because this is what I do half my day is people want examples of different conditions. I've seen COVID-19 recovery, especially long COVID, IV. But here was an example when COVID was alive and unwell. This is from 2020. University of Miami took patients that were 1 foot on a banana peel, 1 foot in the grave. These were older patients, on their way to basically dying. 200 million cells IV over 3 days. At 1 month, 91% survived in the stem cell group, 42% in the control. At less than 85 years old, 100% survived. Time to recovery. Greater than half the patients treated with MSC infusions went home within 2 weeks after the last treatment. And recovery by day 30, 80% of the treatment group, less than 37% of the control group. That's huge. People ask about autoimmune. I say, here's a couple good articles you can get on the treatment of systemic lupus erythematosus or lupus disease and the immunomodulatory effect of these products. And we can make these available if anyone wants to read them. They're easy to find. One of my favorites, RA and irritable bowel. I see a lot of that. Works extremely well as immunomodulator. I've seen people guys who couldn't take a beer because of the hops in it, are going back to, most still have to be careful, but they can eat normally. I had a young man who was so immunocompromised. He was 13 or 14 and he was like 90 pounds. He was the smallest kid in his class, throwing up. His dad had to go to Mexico to get some peptides in order to treat him. It was the only thing that was working. They wanted to put the kid on steroids, all the time. He never would have grown. He got IV infusion. He got treated. He did some peptide therapy. He did go overseas and got a high dose. Luke is now 18. I saw him when he was last 18. Luke, I think, broke or matched the North Carolina bench press record. He bench presses over 315 pounds, and he's muscle now, and he has a happy life. Now all the girls want to see him. Now he had 5 girls ask him to prom. I mean, he's just a really happy guy. So yes, it can be life-changing. I'll give you a little, and this is kind of wrapping up on why we hurt and just kind of the thinking for musculoskeletal. So if any of you decide you want to do any private training or come to our clinic in West Palm Beach, this is kind of where we go. Why do our joints hurt a lot? Well, we are held together by 3 things: ligaments, tendons, joint cartilage. That's our duct tape, and our joint lubricators. They are stronger than steel, pound for pound. They're designed to last us decades, but they don't have a good blood supply. Blood vessels in them would disrupt their integrity. So most of our problems in our MSK system can be traced back to a deficit in one of these. My example, I take a door hinge. So I take a cabinet and I open it up. I say, you got a hinge on the top, you got a hinge on the bottom. I said, well, imagine that's your knee, because the knee is basically a hinge, right? If the hinges are tight and everything's moving beautifully, but if you loosen up one of the hinges, take a screw and with your Phillips screwdriver and pull out one of the hinges about 3 to 4 millimeters and loosen it, so it's a little rattle. And imagine that's the damage you've had to one of the ligaments of your knee, just through trauma or older age or what have you, incomplete healing. Now what happens? Of course, you're going to have instability up high, But if you understand physics, you know you not only put pressure on the upper hinge, you put pressure on the lower hinge. And over time, when you open and shut that thing thousands and thousands of times, more and more that hinge is going to come loose. Then the lower hinge is going to come loose. Then the door is going to sublux, and it's going to start to bang into the other door. You get wood, you get paint on paint, sheared away, then wood on wood, and eventually the thing falls off. So the surgical model is, well, just replace the hinges, replace the door. Our model is, why don't we just tighten up the hinges? So we look at things that hold us together, and that's often where you're going to aim for your injection. The other thing I'll tell people, if you're doing this, please, for the love of God, do not rely on imaging findings to make your diagnosis. We have there it is syndrome as human beings. Patient has, quote, sciatica going down their leg. They do an MRI of the back. There are bulging discs at L3, L4, and L4, L5. Immediately people go, without ever putting their hands on the patient or moving them around, say, oh, that's the problem. You need epidural steroid injections there, and we're going to do a fusion at L3, L4, L4, L5. Patient doesn't do any better. Now, sometimes it is those joints. But then when you ask the patient, they say, where it's my back pain, say, can you point to specifically where you hurt? And they're pointing to below their belt line, like I'm in the buttock. I'm like, that's not your back, bud. And you push down and you realize it's their sacroiliac or their SI joint that's hurting. Well, when your SI joint is hurting and you get unstable, you can irritate your piriformis muscle, that little muscle under your glute max muscle that rotates your thigh out. When you irritate your piriformis, the piriformis is right by the sciatic nerve, and you irritate the sciatic nerve. So my first thought would be, yes, you can inject a little product in the back. You're gonna want to tack down the sacroiliac ligament, and lo and behold, they do better. To give you an example of this, there are two studies. If you're in my field, PM and R, you had to know these for your boards. 1984 and 1994. In 84, CTs were around. MRIs were extremely expensive, not common. Dr. Wiesel and colleagues did a CT scan of people with no history of low back pain, of chronic low back pain. Less than 48 hours their whole life, young people and old people. What'd they find? A third abnormal findings. If you're over age 40, 50% had abnormalities. Nearly half had evidence of lumbar stenosis, which we always freak out when we hear that, narrowing of the spinal canal. Almost a third had herniated disc. 81% had facet arthritis. So I call it you're not 18 anymore syndrome. I promise you, you could be the epitome of health in your 40s or late 30s, and I'll be guarantee if we MRI your entire spine, we're going to find something. And does that mean it's bothering you? No, not necessarily. Not unless you tell me this. So 10 years later, Dr. Jensen and colleagues did the same study. 98 individuals, 50 men, 48 women, 20 to 80 years old, no history of back pain more than 40 hours. You can see it yourself. Almost 2/3 had a disc problem. Over a third had a multiple level problem. If they were over 50, 67% had multiple bulge, arthritis, ligamentum flavum thickening. Again, no back pain. So your MRI, your CTs, your X-rays are very useful guides. But my advice is, I always say your MRI should be what my colleague Dr. Hauser calls, he puts up his hand, he shows his thumb, he says, this is my MRI, my reproducibility instrument. Because if I can reproduce your pain with this or this, that's probably where your problem is. So this is our private training and something we talk about. We attend these, if you want to attend these trainings, we literally do 2-day course where we do all day musculoskeletal, all day spine, and my colleague, Dr. Radich Joe, who's amazing at this, does a lot of cosmetic hair restoration, skin restoration, and occasionally we do sexual wellness. So we work with the University of South Florida. We currently actually go to an old slide. We do most of our time in R3 Health, which is in West Palm Beach. Right now, it's an amazing facility. And basically, everyone there gets a hands-on training. So by the time you're done, I always tell people, at first, everyone's worried. They're not, the first knee, everyone jumps because they haven't done a knee. By Sunday afternoon, everyone's bored. I'm like, I've done plenty of knees. I've done low back. I've done cervical. I've done elbow. We get a lot of knees, cervical, thoracic, SI. We get elbows, knees. We get interesting ones, too. We get some wrists in there. And then we get neuropathy patients, and occasionally we get intravenous patients to talk about those. So it is very hands-on. You are welcome. If you are a medical practitioner and you've signed up for the course, you can actually do it yourself. And if you've never injected anybody, Joe and I always say this, we will literally hold your hand if we need to, to inject that needle or inject that IV and have you do it. And I promise you, you'll get over the heebie-jeebies and you'll be able to do it by the time you're done. Here's a good example. Here's a slide I give people. I go joint by joint. They say, well, can you give me some guidelines? I say, okay. So for lumbar spine, I'll often say consider 1 ml of Restore Plus, like either 5 million or 10 million, depending on how many levels you want to do, 2 ml of exosomes or Rexo, and then the charge product 4 to 6 weeks later. That's a fairly good guideline. Dilute 1 to 1 or 2 to 1. Each facet joint is going to be about 1 ml. So you can kind of do the math and figure how many levels I want to do, how much product do I need, how much do you want to dilute. It is not rocket science. It's really pretty straightforward. We teach you how to inject the perifacet injections. These facets are the highest yield. I like to show people how to do the iliolumbar ligaments and also the SI joints and the iliolumbar ligaments on the side here. So, but how to do the exam, how to look for SI joint hypermobility. You'll see this a lot in people who've fallen on it. You'll see it in either women who've had multiple children, but the second, third child, sometimes that SI joint doesn't go back to normal. And they'll say, after my third kid, the darn kid, his head was pushing way back on my pelvis. And you'll see them when they rotate forward, one side's hypermobile. And I ask them, do car rides hurt? Yeah. Does it go down your leg? Yeah. Does it hurt when I push here? And they go, ouch. And when you hook your thumbs on the bones in the back, the PSIS, and they go forward, one side rotates higher. I'm like, that's your problem point. So we definitely want to get that. So that's one example of one joint we'll do. It's basically the how-to and the battle plan of like how to inject and how to basically make the best use of your product. My notes are always, I think these are common sense for most people, but always work at your comfort level. Build your repertoire. I have people who come in and say, I just want to learn how to do knees and shoulders. We're going to start with that. We have a lot of knees and shoulders. We have a lot of golfers. Okay. And a lot of people make a great living doing knees and shoulders. And then they say, you know what? Now I'm going to start to get into neck. Okay. But build your repertoire. Like I said, I'll jump down what Joe says. Know what you know what you don't know, and know when to ask for help. And don't be shy. I'm available by call. If you need, contact me. I'm happy to speak to you. But don't fake it till you make it in this field. You'll be surprised at how fast you can build your repertoire. Again, imaging studies, they are not a substitute for your eyes, your ears, your hands, and your brain. A good history is going to tell you most of what you need to know. Your exam should tell you the rest. The imaging studies are an ancillary. So before people will come in and hand me their studies, and I'll say, thank you for that. But if you don't mind, let me ask you some questions first. Let me examine you. And then let me look at those and see if they kind of jive. Now, imaging has its uses. If you think there's a late-stage stress fracture, if you're suspicious of things like tumor or infection or something weird, go ahead. Like if you think there's a tumor, get an MRI with and without contrast if you're not sure, just to be safe. Follow-up, my advice to you, call them 1 day later, call them a week later, 3 weeks later, 6 weeks. That's usually my follow-up visit or second treatment, 3 months and 6 months. Why that far out? See how they're doing? And it's amazing how many people will call you and say, I'm so glad you called. I was going to call you. I forgot. I hadn't gotten around to it. My back feels great, but my shoulder's bothering me now. Can I come in and get treated? Well, you just got a patient and you help somebody. Complementary therapy. If you do ozone, prolozone, PMF, Acumen, shockwave, set them up with physical therapy if you do it. So make it a program. The patients do better. Always remember safety. Always remember aseptic technique. Be really big about that. I like the Dunning-Kruger effect. I think medicine is like anything else. Dunning-Kruger effect, if you're not familiar with it, is these two guys who basically said people who are new to the field or who are overconfident tend to overestimate their abilities. And I think I have fallen into this camp. You learn a little about the field and you go, oh God, I got this. This is how hard is this? And then you start to realize how much more you have to learn. You realize, man, I was dumb. I understood I'm the blind man feeling around for the elephant. I felt the trunk of the elephant. I figured I knew the whole elephant. Then someone took my goggles off. Now I see more of the whole elephant. So nothing to be ashamed of. There's a lot to learn. I'm learning more about this every week. I learn something new. I've been at this for a while. So don't be afraid to say I don't know, because that's how we learn. In terms of talking to patients, I love this quote by Ian Rand. You can deny reality, but you cannot deny the consequences of denying reality. This is particularly true with musculoskeletal issues. People will let bad joints go for a long, long time. And I promise you, if you're over 45 or 50 or so, the check engine light is going to come on. There will be little signs your body's telling you that things are bugging you. Don't ignore them. Statistically, most people, if the check engine light goes in their car, statistically, 90% of people within 3 days are going to go get that car looked at. If your check engine light goes on in your knee or your shoulder, people will let it go for weeks, months, or years. And I tell them these little problems you had are going to be big problems. Our friend and colleague, T.R. McManus does a study. He has a clinic in Costa Rica and tells people, I understand this can be expensive, but when you compare it, if you put it in perspective, one bad, severe, large joint can cost you over $110,000 in a lifetime. When you add up doctor's bills, surgeries, medications, copays, time missed from work, time from friends. I always say the crew of the Titanic didn't need to sink. Multiple warnings were out there. The guy at the helm wasn't paying attention. They were in the wrong waters at the wrong time. They didn't have the binoculars up on the top. The telegraph guys were told, you have icebergs ahead. The telegraph guy was talking to somebody you found and said, go away and leave me alone. So by and large, don't be the Titanic. I tell patients, don't ignore this stuff. Do something early so you don't have to worry about it later. This is my final thoughts. Just a quote by George Bernard Shaw. I say, if you're in this industry to serve, you're here to help people. I'm not here to sell. I'm here to serve. Making a living to me is a byproduct of what I like to do. And I don't want to be, I love saying, don't be a feverish, selfish little clod of ailments and grievances, complaining that the world won't devote itself to making me happy. I want to be thoroughly used up when I die, for the harder I work, the more I live. I rejoice in life for its own sake. Life is no brief candle for me. It's a splendid torch, which I have got hold of for the moment. I want to make it burn as brightly as possible before handing it to future generations. You are giving people hope that don't have hope. You have to give them real hope and not false hope. You have to be able to distinguish between the two. But if you really think you can help someone based on that, you'll be shocked at how many people will be very grateful for what you do. So please enjoy what you do in this field. And with that, I'm going to thank you for your time.
That was so awesome. I love your heart and how much you've helped me. There was times where I've been using New Life products since 2018. I've had both of my feet done, my knees done, my shoulders done, just from playing sports my whole life. And literally it was one point where I was almost crippled. I could barely even walk. I gained 100 pounds and woke up literally the next day, and it radically changed my life. I've seen it time and time again. As most of you guys know, we had 3 integrated offices, been using New Life since 2018. One of the calls, Dr. Stavrakos, you got on with me. We had an MS patient who was wheelchair bound, couldn't even use his hands or his feet anymore. Obviously, his dream was to be able to walk, but he was elated because we did the IV therapy with him. He was able to use his hands and sign his name on one of our forms.
Oh, and that was your patient. Wow. Yeah. Remind me, how much, may I ask, how much did you give him? I don't remember.
Gosh, I don't remember now, because that was a few years ago.
Yeah. 10 million. Yeah.
Yeah. Whatever you told me to do, that's what we did. And his daughter was elated as well. You know, obviously he would love to walk, but do you remember him, Melissa? Or were you at the office at that time?
No, I do remember him. Yeah.
Yeah. So
I
for him
remember how excited he was when he came in and right.
Yeah.
Those cases, there was, I think we have an video of a lady who got exosomes. She got Rexo, and she had Parkinson. There's a video of her walking before and after. And you might have seen it. She's got a wide base gait. Her hands are shaking. And then I think it was 48 hours later, normal walk, normal gait, legs are back, no shaking in the hands. Those are the ones that blow my mind, you know. And so thank you for telling me, because I never knew how that. I always want to know how those were going. Those are great stories to tell.
Hundreds of stories in the time that we did that over 5 years and in 3 offices. That's why I've been such an advocate for New Life. And why I wanted our clients to be on here as well. So we would love to know if you guys have any questions at all. Please do put them in the chat. So if you want to raise your hand, we'll put you on here. But we so appreciate it. Go ahead, Vanessa.
So sure. What's the difference between the New Life and the Wharton's jelly? Like, are they 2 different things?
No, Wharton's jelly. So New Life is the company, the tissue bank, and Wharton's jelly. So there's cellular Wharton's jelly and acellular Wharton's jelly. In this case, I was talking about cellular Wharton's jelly, which are what people would call stem cells. They are the actual live cells that are removed from the umbilical cord. I mean, if you ever cut an umbilical cord, if you've ever been there for a birth, and you look inside of it, it literally looks like jello. There are 2 arteries, a vein, a thing called the allantois, and this jiggly stuff. And that has an enormous concentration of stem. So pulling those out, and I guess from talking to Dr. Pabin, it is no easy feat to do that. It is extremely laborious. Extracting those cells, those live cells, what we call the cellular Wharton's jelly. And I like that term just because it's a little more apropos. I mean, you can say stem cells, those really are, but it tells people where they come from. Does that make sense?
Yeah.
Did I answer your question correctly?
Yeah. So we can answer any questions that you have more specifically after we're done. I also wanted to mention too, with the training with Joe Radich. He does have a beautiful office, and I think you guys have a training coming up next weekend, correct?
Okay, yeah, that.
Okay.
Yeah, we
So
have March, then probably 2-3 months later, we do about 4 or 5 a year typically.
yeah. But I actually had Joe Radich come out to my office because at the time I had 4 providers that I needed to have trained. So they actually will come to your office, and it was a way for us to generate a ton of revenue that day. We actually did a P shot, an O shot. We did an aesthetics facial. We did hair injections. And then we did joint injections as well. So if you're thinking like, hey, I want to get the training and you have multiple providers, it might be more advantageous for you to fly Joe out. He could do the training and you can line up a bunch of people for services. So you learn and you make money at the same time.
Yeah, Scott will do it. Joe will go or I will go, depending on location. And we just literally ask you, what do you want to see? I mean, just literally, that's the nice thing about it. It's your patients. Most people charge them at a discounted rate, or it's a great chance to do your family, your friends, or your office staff. I'm sure everyone in the office staff's got something, even if it's just, hey, I want a facial, I want to smooth your skin. But it's a great chance to, like you said, make some money to cover your costs. But it is literally you and your staff, and whatever. There's no right answer. If you want to do all P shots, we'll do all P shots. If you want to do all back, we'll do all back. Most people want a mixture. But those are some of the most rewarding ones. It's just, like I said, it's fun to meet people. I love going to like Seattle or Yucca, Arizona, and just meeting people in that part of the country. Say somebody out there.
Absolutely. All right, guys. Any other questions before you get wrapped up? We want to make sure that you have what you need. It's a quiet crew today. All right, no problem. Well, if you guys do have any other questions, and for those who are watching the replay, you can always give us a call at the dojo or send us a text. We're happy to get you guys connected or answer any preliminary questions. Anything you want to add into there, Thomas? Oh, there we go.
There you go.
There we go. Can you guys hear me
Yes.
now? Just great presentation. I always enjoy it when you get on here and go through these PowerPoints. Any questions that any of the providers have, go ahead and reach out to the MedPro Dojo. Luke, myself, we're also available here for you at New Life. Looking forward to working with everyone.
Right. Dr. Stavrakos, any other success stories or wins that you want to share personally? I'm going to ask you a question. One of the biggest things is the shelf stable versus cryopreserved, because all of your stuff comes cryopreserved. So the difference between shelf stable, like putting it in a regular refrigerator, versus cryopreserved. Can you talk a little bit about that?
Okay. Sure. Typically, when these are cryopreserved, the products are typically held at minus 80 degrees Celsius. My understanding, talking to Dr. Pavan, is that you want to keep the live cells at minus 80. The exosomes, you have a little bit more leeway. Sometimes people, I think, short-term can be put in the freezer. So the advantage, and those of you who've done this know this, is that when you get your products, they're going to be on dry ice and sealed up, hermetically sealed. And you're generally good for a couple days. I mean, sometimes it's 3 to 4 days. So figure a day in transit. If your patient's coming on, you order them Monday, they come on Tuesday, you're typically good till Thursday. Now you can get a sub-zero freezer. If I were able to move my camera, I'd show you one, and that thing keeps mine. So I've got that plugged in all the time. That being said, if your patient can't make it or something happens, don't worry. You can go honestly to your local grocery store or drugstore, buy some dry ice, break it up, put it in there, and you can repack them down there. So you can keep them on ice, quote unquote, for plenty of time. I know that's always a concern with people, but yes, the live cells, you want to keep them cryopreserved at around that temp until you're ready to use them.
Somebody had asked, so exosomes are cellular. They are not, correct?
No, they are acellular. Correct. Yeah. And one thing we'll often talk about to make it easier is we'll say, one of the terms we'll use is cellular product or acellular product. So exosomes are acellular. I always say, if I'm a Star Wars fan, so if a cell is the Death Star, an exosome is the size of an escape pod in the movie. They're tiny. Now, the great thing about exosomes being so small, one thing they can do is they can cross the blood-brain barrier all by themselves, which is why I think they've worked so well for CNS conditions, like, post-COVID brain fog. One success story was a guy we had. He's one of our reps. He's offensive lineman in football, I think at West Virginia. And he, of course, as a lineman, he had multiple concussions. And back then it was, you got your bell rung, smelling salts, get back out there. And he just, like a good player, he just kept playing. And he has gotten through most of the issues. But he's done everything from PMF to acupuncture, IV ozone. But one issue that he could not kick was restful sleep. He'd get maybe 3, maybe 4 hours on a good night, and it was interrupted. And this has been years. And so we gave him the IV exosomes. And he sent me a link for a YouTube video. I clicked on it. It's him in his pool saying, I want to thank New Life and you guys. I'm getting 8 hours of sleep a night, restful. I see that in post-COVID, that are brain fog or headache, sometimes within hours. So that is one great thing about this. So they're not cellular, but there is an advantage to that, is they can literally go everywhere. And probably, your body takes about 7 or 8 minutes to pump blood through the whole body. They're going to move pretty quickly.
No. I've done through IV. The couple questions here is no, I don't think this is accurate. It says shelf life is only a few days. Then you're talking about a shelf stable product, Dr. Miller, and then he's asking, would you use a nebulizer for COPD or dementia or Parkinson's? How would you use the products at New Life for those types of conditions?
So the short answer is it depends. Really, COPD, possibly, yes. So I always look at the patient, their health, and how severe it is. For COPD, that actually could be quite helpful. Why? It's an easy means of administration. Dementia, Parkinson's, I am not averse to doing nebulized. I think it will help, but I find the strongest way to get it is intravenous. Parkinson's is a central nervous system issue. So by themselves, the exosomes are going to get there. The stem cells may not. Now, we do know we do infuse people with stem cells, and they do remarkably well. So like I said, it's not just about the live cells. It's the paracrine signal and the immunomodulatory that does seem to transfer across the barrier. But if you really want to get the cells there, there's 2 ways you can do it. One is you can have a pain management doctor do, an epidural or the like. Not everybody wants to do that. The other is you can hang a bag of mannitol, and there's a protocol for using mannitol. Because mannitol is what, if you probably know, in the ER, it opens up the blood-brain barrier. If you get fluid in the brain, like a hematoma, mannitol is what's going to save your life and drain that. So slow infusion of IV mannitol will allow that to happen. And I think I've written out a protocol a colleague of mine gave me years ago. He's a neurologist who's done this, and that's available as well.
And then so with the exosomes, since they're acellular, they don't have more shelf life, so to speak, in the refrigerator?
Well, both products, if you keep them frozen, honestly, they are good for up to 2 years. I mean, that's their life.
Frozen, but the exosomes are acellular, so they should last a lot longer, or you still only do a few days?
Honestly, it's the exosomes. Honestly, I've had people put them in the freezer for a couple hours or a day or so. They may work well. I've never used them beyond that, to be honest with you. So
Okay.
I couldn't comment. Honestly, though, if you're concerned, and if you get them, 2 options. One is get them right before you need a patient. Get them there. And if you need to keep them for a little bit, I mean, really, I found this out myself when we had a power outage here. Dry ice is pretty cheap. I literally took an ice pick, broke it up, repackaged it, and they work beautifully. But the freezer is my best friend now. That I'm more worried about that. I've got a little generator next to it now, just in case things go down. But even if that went down, I really just keep one of your old boxes from New Life handy. Grab some dry ice, pack it down there, and then once the storm is passed and everything's working again, you transfer them back.
Yeah.
If
So
I could
really,
lend this
I think
back.
there's some context here for Dr. Miller, because there's another product that's out there that says, oh, you can just store it in a regular freezer, like a normal refrigerator freezer. And I told them that it's important for it to be cryopreserved and in specific freezers or dry ice, because they need to maintain that negative 80 degrees for the viability of the product. So some of the other competitors say, oh yeah, you can just put it in a freezer, but I was telling him that that's not the case. We either kept a nitrogen tank that could keep it at that temperature, or we used a freezer, but I would never put a product in a regular refrigerator freezer.
Yeah,
That's a
the
good question.
negative 80 for the cellular components really
Yeah.
important. For the exosomes, it's less important, but that's still the recommendation of keeping it at that negative 80 degrees.
Yeah,
And if we have a patient tomorrow needs stem cells, we can order it today and get it tomorrow, or what's the turnaround time?
Yep. As long as you order it by 3:30 Eastern time, we can get it out to you overnight shipped on dry ice, and yeah, it'll arrive usually before 10:30 in the morning.
Wow,
Mhm.
cool. Thank you.
they're great
Yeah, of
about that.
course.
You're at the mercy of FedEx, speaking as, someone who's gotten these. So my usual advice is if you have a patient tomorrow, doc, schedule them in the afternoon in case FedEx is running behind. If you've ever tried to get a hold of FedEx, it's an exercise in futility. And usually they're there on time, but I'll usually tell the patient to come at 2:33 to be sure, because I know by then we're gonna chances are, unless there's an issue, we're gonna get our product and we'll have it ready.
All right, awesome. Well, thank
also-
you again. Oh, go ahead. Sorry, Luke.
We offer a freezer, an ultra cold freezer for if you spend $12,500 worth of allografts, you get that for free. So if you guys are really trying to amp up the regenerative medicine side of your clinic, that's a great starter option. And then you have the product on hand, and you don't have to be at the mercy of FedEx, like Dr. Stavrakos said.
Yeah, it is a great way, especially if you do a high volume. It's nice to have that. All righty, everybody. Well, thank you so much for being here. We'll have the recording of this. If you would like it, please do let us know. Other than that, have an amazing day, and let us know if you guys need anything. Give us a call or send us a text.
Thank you so much, guys. Much appreciated.
Thank you, guys.